Maui and its communities are forever changed by the wildfires. We can learn a lot about recovery by looking to the past. Many years after the attacks on 9/11, significantly more lives were lost as a result of exposure to environmental hazards, teaching us that early monitoring is essential for Maui's recovery.
In January, we launched the Maui Wildfire Exposure Study. MauiWES follows participants affected by the fires to monitor their health and disease risk over time. By studying impacts now, we're in a position to prevent short and long-term conditions such as lung disease and cancer, which our population is already more susceptible to.
Our study includes more than 650 individuals from Lahaina and Kula. Many are Native Hawaiian, Pacific Islanders, Filipino, as well as Hispanics who are underrepresented in Hawaii studies, giving us new insights into health disparities.
Since launching the study, 3 major trends have emerged. 1, mental and physical health issues. 2, access to care. And 3, housing, job, and food insecurity. Worsening physical health is reported by nearly 50% of our participants. They're already showing signs of increased risk for cardiovascular and kidney diseases and are experiencing respiratory issues. Depression is reported by more than 50%, with lower rates of self-esteem and an alarming increase in suicidal thoughts compared to before the fires. Access to care is also a concern, with 3 times more people struggling for care or medications.
Lack of health insurance is another barrier among Hispanics in particular. Hispanics are uninsured at a rate 6 times higher than the statewide average. Overall, there is still significant unemployment and loss of income. More than 40% of households are finding it harder than ever to get enough food.
On an encouraging note, we're observing that people with strong social connections have better health outcomes, and lower income individuals are trusting and utilizing community organizations more than government services. This tells us just how vital grassroots organizations with strong community ties are to Maui's recovery.
These emerging insights, as well as others, will inform prevention strategies. Our findings from this cohort can help mitigate high mortality rates and cancer, which have been observed in other disasters. It took more than 20 years to learn about the long-term health consequences from 9/11. We are committed to following our participants as long as needed to support recovery for the people of Maui.
We're speaking with our congressional delegation about how MauiWES can inform policy and encourage federal appropriations. Like in the aftermath of 9/11, we hope that this will lead to establishing treatment centers and long-term registries for Maui's communities. We're very grateful to our partners, Hawaii Community Foundation, through the Maui Strong Fund, and Kaiser Permanente, who seeded our study. They, along with our many community partners, advocated for another year of funding through a one-time state appropriation.
The most recent report is available at the link in the description. It details who we are working with, what actions are being taken, and areas that require more research to help Maui heal. If you would like to help, please contact us through our website. Mahalo and aloha.